Afternoon. Welcome to Health and Human Service Committee, which is Wednesday, March 19th at 1:02 p.m. I'd like to call the meeting to order. Do I have to get first a second? Just go. Yeah. All right. I do have a slight change to the agenda, if that's okay. We're going to have the county administrator's report at the end of today's agenda. We do have somebody here for public comment. Rules for speaking under privilege of the floor. I agree to the 3-minute time limit. I agree not to raise my voice. I agree not to use lewd, obscene, profane, slanderous, or libelous language, or speak or act in a manner that would tend to incite a breach of peace. I agree not to speak about county personnel matters. Personnel matters include comments about the job performance of named county employees other than elected officials. After 3 minutes, I agree to leave the microphone and yield the floor. Transferring time to another person is not permitted. I agree to be courteous and not make comments, gestures, outbursts, or other disruptions while other members of the public or legislators are speaking. I agree that if I cause a disruption and I'm asked to leave, I will leave the chambers. Our first person is David Sanders.
Thank you very much. My name is Dave Sanders. I'm the Executive Director of OAR. I'm here to talk about the homeless shelter or lack of a homeless shelter. I watched the last 3 meetings of the Health and Human Services Committee, and Travis, you said something close to the fact that you get public feedback typically when it's too late and decisions already been made. So I know this is early, but I think this is a topic we really need to talk about. I know that the county is looking at a consultant, and I've seen some great reports from consultants in this community. The CGR report was phenomenal. I know the consultant is going to help you with finance, permitting, and developing. I think that's wonderful. I don't know if a consultant in a short amount of time can get community feedback to what it needs to be to address homelessness in our community. I've been working with the City of Ithaca on the unsanctioned camping team, and to be honest, I think the county could learn a thing or two about how the city's been working with community partners. Recently, they've had an advisory group that they put together to develop strategies and share ideas. The amount of diversity and ideas on this committee are phenomenal, and they're really, doing a great job at looking at homelessness here and what we could possibly do. They put some resources and funding into addressing homelessness. I'm not sure if the county and the city are working together, but imagine the outcomes if you were. And again, imagine the outcomes if the city, the county, and community-based organizations all work together on homelessness, what we could accomplish. I'm fearful that because DSS is running cold blue in the shelter, that out of desperation, we might look for a quick solution. And I'm not sure if that quick solution would be the best for our community. This horrible situation is an opportunity, and I would love to see us take advantage of the opportunity to find out how we can re-examine homelessness, what we could do better, and what we might accomplish in the future. I know you looked at the future locations, design, capacities, and hopefully who might run a shelter in our community. I would love you to answer some questions like, is there going to be an RFP? How's the application process going to be? Are you going to involve community-based organizations on a committee to look at the RFPs? Are you going to involve people who used to work in the shelter or people who actually partook or were in the shelter in the past? Who will lead and ensure that we do something different, more effective? And I'd like to see who the leaders are in our community that can bring this together. Thank you.
Do we have any other cards?
The remote attendance person is not on.
Okay. We'll move to minutes approval. Do we have Randy? Susan seconds? All in favor of moving? All right. Appointments. We do have 2 appointments for today. Advisory board appointments. Recreation Partnership Board, Travis Brooks. Term expires December 31st, 2025. Community Mental Health Service Board, Mental Health Subcommittees, Adoranque, Ilagabusi, Recipient Consumer Representative, term expires December 35, 2026. Do we have a mover? Second. All in favor? Yes.
I'm voting for it,
Chair's report. In front of you all, you have the goals and priorities for 2005. I wanted to spend a little bit of time talking about the goals. Everybody submitted their goals. Taylor was kind enough to put it all together for us, and this is what we have. So I'll open the floor, and we can move the discussion and figure out how we want to proceed with our goals and priorities. Sean?
Yeah, I just looking at our first goal of examine and determine steps moving forward with the Office of Human Rights. I absolutely want to commend our the Human Rights Commission on their programming. I know that we currently do not have an office in place right now, or I guess it exists one day a week or whatever the setup is. But the commissioners put on an event the other day that I will say I have never seen so much publicity. I've never seen so much chatter online, and it was all done in part to our commissioners. And so it's just very, very impressive. And you could truly see their dedication to human rights in our community by the way that they serve. So I want to really commend them for their efforts, especially as we try and navigate how we're going to move forward.
I'd like to add to that. I mean, they started last year with this series they're calling Unmute Yourself, taking on special topics. The first one was women's experiences with healthcare, trying to access healthcare. It was phenomenal. And this latest one, I think, was to deal with homelessness, actually. So they are phenomenal. They have a really good group, well organized, and I think their determination for educational programs is really to be commended, and I hope that we can find a way to support them.
Others? Sean?
Sorry, I just want to add one more thing. I think one thing that the commission has done really well is actually invited people in with lived experience. And 5 years ago, 10 years ago, since I've been on this legislature, we've sometimes ignored that. And I think, if we're having a panel on homelessness, it could be Travis, it could be myself, it could be any one of us sitting on that board, but the reality is most of us have not had that lived experience. And so whenever we add people's perspective that have actually been part of that situation, it just adds so much more. And I would rather go to a panel any day with people that have lived experience and hear their stories, because for me, it's so much more impactful. And I feel like we're able to do our jobs better, and our community is able to understand the trauma and the pain. And for me, reading the testimony yesterday on Facebook, it really provides connection to people. So I just want to thank the people that were vulnerable, that shared their stories. I really can't say enough great stuff about what happened the other day.
While we're still on the Office of Human Rights, I just want to recap what I think is happening and express my desire in that. Corsa, your folks are going to get together, some people from the community, some legislators, people from the Human Rights Commission, and put together options of what you all come up with that would be the best way to move forward and present those to us, correct?
Yes.
Cool. I just want to, for those that are listening, I think one of the goals when I thought that I wanted to run for office was to be able to get more community involved and more voices involved in some of the decisions that we make that involve the community, right? I know Mr. Sanders had brought up the idea of community being involved in how we move forward with the shelter, how we address homelessness in our community, what that looks like. And without question, one of the things that I will hope to do is to have community involved in that process, to have advocates, to have providers, to have people with lived experience, to have folks that work at DSS, to have everybody in this collaborative group to figure out the different ways, because it's not one way that we move forward, it's different ways that we move forward and create solutions and support what's being done, and take inventory of things that are working. So I know for me, and I trust that the folks that I serve with, that is something that we're all committed to do. Is there other goals and priorities that folks want to highlight, talk about? Amanda?
Well, we kind of talked about it last time, and it's on the list, but the Health Planning Council, and you, Travis, are going to be the liaison this year, and I've been the liaison for numerous years, and it's a great group. I've never really known how we relate to it, though. Like, they're kind of doing their work, and how, you know, what should we be doing to support them? What should they be doing to support us? What do we need to know? So Travis and I are going to try to sit down with Nicole Zulu and maybe like talk a little bit more about that. Maybe have them come, or have Nicole come. The chair of the council is Laura Perla, so maybe she could come too, and just kind of try to align what we're doing, and so we all understand, you know, their goals, and I think that just clarification would be good all around, and we're working on that. So
I was able to go to my first meeting last week.
oh, good, great.
I was actually, it was a good meeting, and I can see, you know, during the meeting, I realized that you're absolutely correct. There is a tie-in. We just have to figure out what that looks like and make that happen. But I was glad to be there. And it's a really good group of people. I've been able to work with some of them in different roles in the past, so it was cool to be there. Others? Any of the goals? Randy?
Yeah, the making services accessible in the Department of Social Services. I think that where I think that's important, but I think that we need to also collaborate with the community for the people that want to help with that process. It shouldn't just all, you know, funnel through DSS and put stress on them when there's other entities that are providing SNAP assistance or whatever it may be, and allow them to work with people to get them pre-qualified before they may end up going to DSS and finding out that they're not going to be qualified for SNAP or something. And I think that there's entities out there right now that are willing to help.
Yeah, I agree. It would be great if folks that were applying for whatever type of service were able to do like their pre-packet, you know, like when you apply for a home loan, you're able to go and get pre-qualified for everything. And then, so for folks to have all that stuff worked out, know what they need, and then show up in one appointment with everything that's needed instead of going back and forth. We have transportation issues. People have to take off work. If they have work, most folks that would need services are hourly, right? So they miss all of that. So it would be good if we could engage community in that. And I believe we still have some navigators, and there were other agencies in the community that were kind of designated as those folks. So maybe that's a conversation you and I can have and explore that with some folks at DSS.
Yeah.
And we'll course it.
And with the Food Bank of the Southern Tier becoming more involved in our community and bringing all the different food suppliers together, and them taking over Tompkins Food Future, which is managing the food system plan, I think it all kind of fits together, and they also were doing similar things. So,
Absolutely.
Yep. Yep.
Others? Yep.
I'll keep going. So I put on here mobile home park or manufactured home park regulations, and I know a lot of people. I go into a lot of mobile home parks, and I know there's issues in some with have water qualities or sewer qualities, and there's also minimum state requirements, as I understand it. That's why I put this on here. I'm not really clear on what all the true state requirements are of our environmental health team as to what they're supposed to be monitoring and any issues there may be. For example, there's one right now that they haven't picked up the garbage in 5 weeks. So you just go, it's piled all along this place, and I don't know why that is, and I know that they've worked with this particular owner in the past, but that's just an example. And the other one I put down, I've talked about this one many times, is youth engagement. So, and I know I've been all over the board on this one, but so I've like to narrow it down. And so I went through just a few publications, and there are 7, and one was Ithaca Parent Teen. And I went through all the things that were available for people to do. And I came up in a matter of an hour, 72 things. And I bet there's 172 things. And so I think that it's in 211's focused on it. They're gathering more data, and they've gathered a lot of data on what's available for youth. And the focus for me should be more in the teen area because most of the services available now are younger people. And I think that providing that to the people who are working directly with the youth to say, here's 172 things. What do you want to try? What do you want to do to engage those people? Because in meeting with the school district in Newfield, I've met with them 4 times, social workers, counselors, dean of students, the superintendent, teachers, and they all know the kids that are struggling. And they know them by name. And they want to find something for them to relate to. And so I think that we need to give them resources to say, here's an opportunity for this. Maybe, whatever it may be, building a drone or whatever it is. So I think that's the easy part. I think identifying all these things through 211 and other entities. And then the issue is the barriers for people, for kids, not to be able to participate in these events. And I think transportation is a big part of that. So I think that's the low-hanging fruit. And I'd like to focus on that part of that. So.
In the 26 years I've been working at the Greater Ithaca Activity Center, transportation is always a barrier. And then funding is always a barrier, right? Who's going to pay for it? And we used to have, and Kate's here, and she may be able to help. For many years, we would have, through the youth department, we would have a youth summit. And it was folks that worked in the field, working with young people, whatever agency, whatever capacity. And we would get together and we would talk about these things and kind of figure out, how we could support each other, where the gaps were, and try to connect and engage young people. And I know we still do it through YERT for employment, for summer employment, right? So, Kate, and I have missed it because my role has changed over the years at GIAC, but do you all still do that where you bring people together throughout the county that work with young people?
So in terms of our funded agencies, yes, we're talking to them every quarter. We're getting data from them. When it comes to community partners, we're talking to them on the regular. Has there been an actual summit in quite some time? No. One of the things that we're going to be working on in this coming year is going to be updating our Achieving Youth results, which is tied again to the strategic plan, and then also looking at making sure that we want to do a community-wide needs assessment. And I believe that really starts with what you're just saying, right? What you're just talking about is bringing those folks to the table and having that conversation. Sadly and unfortunately, we've had capacity issues with staffing. That's been an issue, and not just for us, but all nonprofits, right? And the youth-serving organizations. I feel like we're finally starting to come out of that, and people are getting their legs under them. And so, and to Randy's point, 211's a great resource. We as a department pulled all the things that came from 211, and a lot of those resources were no longer there, they were not updated, or they were duplicates, right? I think there was some 1,500 different links that were available at some point in 211. And so our partners over at Youth Employment have created a resource map right now that it's a Google map that you can go and you can find resources. And really what my goal is for the next year is to really do what you said, pull people together again, really have a cohort conversation and figure out what are the struggles and how do we do better? How do we look at our allocation of our resources? How do we use data to drive those decisions? And that's really what we're going to be focused on, because I think we're long overdue for one, and I think we're at a space now where people have a little bit more bandwidth and capacity where we can have those conversations. So.
Is it possible to form a committee with some of the funding partner agencies and ask, is there anybody from those agencies that would like to work with you and your folks? Because I do know capacity is an issue, right? So sure, something like this falling on 1 or 2 people is a big deal. Yeah. I know I have staff that would be more than happy to participate in helping to put something like this together. I think that everybody's about to shift into summer mode. And then before the end of the summer, people are going to shift into school year mode. and people will start planning for fall activities over the summer. So maybe it's possible if enough people from the different partner agencies and funding agencies want to form some sort of committee to put this together, that perhaps early fall, late summer, we could put something like that together.
You're right on my timeline, and I'm glad you are willing to help. You are on my list of people to contact. We want to make sure that we're talking to GIAC and Southside, and that we're bringing people together with lived experience, families, school districts. It's a big push, and we need, it's a heavy lift, so we need help from the community for it to actually be a community plan. So I'm all in, and that's where we're headed. So more than happy to have that discussion.
Awesome. Yes. Susan.
One of the things that I think, I don't think it's happened for a while, but all of the libraries in the county used to be part of, I think, that youth summit maybe years ago. And every library has a lot of educational programs for families, children, teens, and they all have fantastic summer reading programs. So I think if there's a way, and one of the things that I saw when I was director of libraries, transportation, that was the biggest issue, even though the buses now stop right in front of the main library, but it's very hard to get around to all of the libraries. So I hope that all of the rural libraries and the main library could be part of that planning as well, because they spend a lot of time working with teachers and schools for reading programs.
Absolutely. One of the ways that we stayed connected with our libraries, and they really have become community centers in the whether it's Dryden with Pamela out there, or it's, you go to Groton, they're great resources for the community, and they are very involved in our municipal youth service system. A lot of them sit on those commissions. So
great.
We are in constant contact with them, and absolutely would love to have them as a partner at the table.
That's great to hear that they've been part of that.
Absolutely. Yeah, it's really a community effort. We do nothing on our own. We have a great community of people who support youth.
Randy.
And the other part of that is transportation, and I met with somebody recently, and the Village of Ithaca is doing a lot of transportation for kids to events, and they've actually been working with parents as well, and getting them to sign off to let parents carpool people, so there's not one particular parent always taking people around. So, and I know CCEs do a transportation for kids, and schools do, so I think there's kind of a subset of looking at the transportation side of that.
Absolutely. Other folks for goals? So what would be helpful, I think, and we don't have to do this now, we could do this over the next week. If you are interested in particular goals, just say, I'm interested in working on or helping with, and send that to me, and then prioritize these so we can figure out which ones of these are most important for us, and then we'll kind of take the tally of numbers and kind of list them out by votes and see who wants to participate on what, and then go from there. Is that fair? Great. All right, cool. We'll move on to Whole Health. There's 2 resolutions. Is somebody here from Whole Health? We have resolution authorization to accept funds, create position, and complete a budget adjustment, court-based mental health navigation, Whole Health Department ID 13170. Do I have a mover? And we have a seconder. And go ahead.
You ready for me? I'm sorry.
Yes.
We froze up for me a second there. Okay. Yeah, as you can see it laid out here, this is for one social work position to do this. This is ongoing funding, so we were comfortable with taking this on. This will be a licensed clinical therapist to do this work, and in the first year there, you do have some other expenses around computer equipment and program expenses, but the funding from OMA should continue indefinitely. So, are there any other questions about this one?
Shana?
I just want to say that I'm really proud of this legislature. Gosh, it was probably 4 or 5 years ago, we actually decided to start the mental health court, and it was fully funded by us, and it was a lot of money, and we were told at one point that we may or might not get reimbursed, or OMH might pay for it. But it took us paying for it for a few years. So I'm glad that we did that because I think the contribution by OMH will allow us to continue to offer those services. And it was clearly a really good investment.
Anyone else? All right. We have a second resolution, authorization to accept fund.
Travis, you got.
Yes, we do have to vote. All those in favor? I just assumed. All right. Second resolution, now that we voted. Authorization to accept funds and complete a budget adjustment, outreach worker program, Whole Health Department, ID 13168. Do we have a mover? Shauna, seconder, Susan. Take it away.
Okay, I've got Ross Milne on here. He's been doing the majority of the work, so I'm gonna let him give you some updates on it, if he has any.
Yeah, sure. Hey, everybody. So this is a joint effort between the city of Ithaca and Tompkins County. Both parties are putting in $65,000 to support operations of the outreach worker program in 2025. And this resolution is to accept the funding from the city of Ithaca and include it in our budget. Just some updates on this program. Staff has been hired by REACH, medical 1.5 FTE outreach worker staff. We anticipate a soft launch next week. Whole Health will be putting out a press release early in the week to the broader community, and then REACH is going to be reaching out to kind of high priority downtown stakeholders towards the end of the week. I think they'll have their outreach staff out there on the 26th or the 27th, paired with some more senior outreach staff, but we're really excited to get this program up and running, and we'll be continuing to meet with REACH and the city and the Downtown Ithaca Alliance as the program gets rolled out, and we'll continue to report to the committee on it.
Any questions for us? Shauna?
I am really happy to see that REACH Medical is their provider here. I think that many of the people that are struggling, that are probably our friends that we're talking about, are navigated by REACH anyway. And so I think there's a nice connection, and I definitely think that they're trusted in our community. The questions that I have is, where exactly are the community outreachers going to be working? Is it going to be just on the Commons? And then my other question is, before, whenever we had the outreach program, it was, there was funding provided by DIA. No, Family and Children's didn't provide funding. They actually provided the service. But Downtown Ithaca Alliance provided some of the funding. It was the county and the city, and QGAMED actually was one of our partners. Is DIA providing any funding here?
DIA is not providing any funding this time around, but they are still very much involved and are contributing in other ways. They've been really helpful in offering, space for outreach workers and making a lot of connections with downtown stakeholders.
Okay. I guess my concern is if we're only providing it for that, like 2 blocks, outreach workers, it's unfortunate because I think we probably need 20 outreach workers that are doing the good work that they do. But it's definitely focused on those downtown businesses. And so I really wish DIA would have come to the table with some funding for this.
Yeah, I thought that, I forgot, the Tammy Baker was the original community, so and her services were so heavily used by the main library downtown. I think it's really essential to have, and she covered a wide area, I think from the Commons all the way out to 13 or something. So I'm really happy to see this come back. I think it's really essential. I agree with you, Shauna.
I'm sorry, Travis.
Go ahead, Shauna.
I guess my question is, 1.5 outreach workers really is not that much help. And I'm going to go ahead and vote for it, but is there any way we can have a conversation to maybe double that amount and have DIA come up with some funding?
I mean, it's something we certainly could investigate. One of the parts of this, the work that we need to do is sort of looking at all the outreach worker programs and make sure that they're coordinating really well. And so that being part of it, but we can certainly take that back and see if we can see what else we can come up with.
Yeah, and again, I'm gonna vote for it. We'll push it through here, but it'll be another 2 weeks before we have our legislature meeting, and I would love to hear a response from DIA.
I think the question for me, piggybacking off of what Shauna asked, is the focus the commons? Is that the focus?
Yes.
So I do think the DEI should have some skin in the game, just like before, because the main focus, if it's the business community, they should be involved in this. The issues that the outreach workers were dealing with after Tammy left, when there were two of them, I believe, were all the way from the commons all the way to the encampments. And so when the program was toward the end of the program, it was this idea that we needed to rein back in the outreach workers and have them just focus on the commons because of the businesses. If part of that belief is because of the businesses should be part of this, and it shouldn't just fall on the county and the city, because we have a bigger area in the county, we have a bigger area in the city. And I worked with the outreach workers through LEAD. They were part of our OWG meeting, and they did amazing work. Their work was amazing, and they were a critical part of what we were able to do, because they could work with everybody regardless of their situation. If they're just focused on the commons, I find that to be a little problematic, to be honest with you, without the DEI being part of that and how they were absolved of this partnership in terms of funding. I'm going to vote for it because I know that the program is needed, and there's been proven success. And who is connecting with REACH so that we know that we are getting the outcomes we're looking for? I think part of the problem toward the end of the last iteration of this is nobody from the county or city was communicating with the last contractor. And so people didn't know exactly what was happening and what was going on. Is there somebody designated from the county or the city to meet with REACH on some sort of regular basis so that we know what exactly is happening with the program?
Yeah, and so as Whole Health, we are the contract administrator for this, and we have established a bunch of performance measures and outcome measures with REACH in collaboration, and those will be what we'll be collecting on a quarterly basis to, assess any challenges, things that we need to change going forward. We'll be continuing to meet with them regularly, but as with any of our other contract organizations, we can provide those results to local legislatures on a quarterly or annual basis and look at steps we need to make going forward.
Thank you. Any other questions? Ready to vote?
Yeah, just like annually is not nearly often enough, so I think quarterly would be a.
Were you able to hear that, Ross? Quarterly?
I was, yeah. Thank you.
Okay. Ready to vote? All those in favor? All right. Would you all like to give any updates while you're on camera?
Sure. The Commissioner for Whole Health job posting is up now as of last Friday, so that's exciting news, and we really appreciate the help of Corsa and HR on getting those minimum qualifications a little more aligned now that we are under now that we've integrated. We really need someone who can provide really good leadership rather than necessarily being attached to one side of the house or the other. We really needed someone who can just be a really great leader. So that was a good outcome there. We're excited to see applications coming in. We are in the process of updating strategic planning a little bit. We're right in the midst of a strategic plan, and it's that time where you can tell what you're going to get done and what is going to be impossible to get done in the timeframes that you set. And so we're really taking a moment to look at all that and bite off what we can chew and accomplish those things rather than have so many things that we can't do and act as if we're going to. So we've got several teams looking at recommendations from the first half of this strategic plan, and then we're going to take some agile sort of technical teams and implement those things rather than do another round of planning. So we're at that point where we've talked enough about a lot of stuff. We want to just get some of this stuff in place. I'm glad you guys are talking so much about collaboration. Collaboration's our theme for the first half of this year. So we are looking at collaborations in the community. We're looking at collaborations among our programming internally. And we're all looking at ways to sort of become more efficient and provide better client service. Those are the two things within that customer service, within collaboration that we're really trying to do. I know that there's a lot of questions about school services when I come to HHS. And so we put in place a plan to have better reporting for this group on a quarterly basis as well, so that you know what kind of school capacity we have. We just got back up to full staff for youth services, so we have a new staff member that's going to take a little bit to come back up to speed, but we are at full staff. And so I want to be able to give you guys updates about any barriers we're finding, and just how we're increasing school services in general, youth services in general, and community services in general. So we're working on what the format for that would look like, so you all have that on a regular basis. Those were my primary updates.
Thank you. Any questions?
Thank you.
All right. Veterans Affairs, JR is not able to be here today, so I have two announcements that he asked for us to read. There are two local events happening in Tompkins County in honor of National Vietnam War Remembrance Day, Vietnam Era Veterans Recognition Day. Number one, Groton honors National Vietnam War Veterans Remembrance Day on Saturday, March 29th, and a special recognition event on Sunday, March 30th, in observance of Vietnam War-era Veterans Recognition Day. Area residents who served in the U.S. military during the time of the Vietnam War. For more information on upcoming events, please reach out to J.R. Claiborne. I can't answer any questions. Let's see. We'll go with Kate from Youth Services, or the Youth Bureau.
You're muted.
I hate when I do that. Sorry, guys. So good afternoon. So basically, we have been working on setting up just what we were talking about earlier, Travis. We're putting together a timeline for updating those AYR sort of indicators and looking at what metrics we're going to be using underneath of those. And then we've been having, talking about the needs assessment, which I think will come a little bit later, but really having deep conversations about what community partners we want to pull together and what that timeline looks like, and how to use youth who are active and involved in the community to be a way that we reach out to those youth and get some responses from them. And so that's really what our main focus has been on in the last couple weeks.
All right, any questions for Kate? All right, thank you, Kate.
Yep.
Lisa Monroe from COFA.
Hi there.
Hello, Lisa.
Yeah, so I don't have a lot to report. Business as usual, really. But I did want to make one announcement about our Powerful Tools for Caregivers class that we have here is starting April 3rd. It's Thursdays from 2 to 3:30, April 3rd through May 8th. It's an interactive evidence-based course that's designed to help caregivers, equip them with tools that they need to balance caregiving with self-care, and we're still accepting registrations right now. So
People can go right online and register?
you can call the office. It's probably easier to do that. Usually we give people multiple options. Not everybody has a computer, older folks or caregivers. So any way that's easier for you, you can find information on our website, but you can also just call the office.
All right, thank you.
You're welcome.
Any questions,
Thank you.
Lisa? Amanda?
I don't know if you've announced this here. I know legislators all got an invitation, but your annual luncheon is coming up on May something?
Yeah. Yes, it is, Amanda.
May something.
It is May is Older Americans Month, and why can't I think of the date right off the top of my head? Of course I can't. Yeah, I usually announce it a little closer, but we do have the registration forms out. Information is on our website, and we'll be recognizing our volunteers, our outstanding volunteers, which there's been 2 that have been chosen, so they will be recognized. And we have a speaker that will be coming to talk about ageism, and it's Elizabeth Bergman from Ithaca College, so she'll be our speaker this year. And I will get you the date, and I can't seem to pull anything up right now, so sorry about that. It's in May.
Yeah, I think we each got an invitation in our mailbox, so
Yeah.
hopefully folks can attend.
Yes, thank you.
Any other questions for Lisa?
Katrina says May 9th.
May 9th.
Thank you, Karina. May 9th.
All right, thank you, Lisa.
Thank you.
Is anybody here from HSC? Oh, you're in the back.
Yeah.
Hello, my name is Lee Barger. I'm here with Cindy Wilcox's update in hand. So Human Services Coalition is currently working with Care Compass. We're working to build out the county's social care network. That's part of the Medicaid 1115 waiver. This project aims to connect eligible Medicaid members with enhanced health-related services related to housing, transportation, food, and nutrition. HSC is helping to connect community agencies to the network, which it provides opportunities to not only expand service delivery, but revenue as well. HSC is working, next bullet point. HSC is working with agencies to gather data on the financial and operational impacts of the potential federal funding cuts. So far what we're seeing is that about 35% of county health and human service organizations receive direct federal funding, and a much larger percent receive indirect funding that passes through the state or other entities. Excuse me. So far, agencies are reporting that they're most concerned about the potential impact on our low-income residents in terms of services such as housing stability, food security, organizational impacts such as staff layoffs, financial instability, and cuts to programs. We're also moving forward working with agencies on scenario planning and advocacy to prepare and position the sector in light of potential cuts. The end.
Any questions for Lydia?
Thank you.
And we have somebody from DSS? No? Go.
Hi, I'm Dina Bodner. I'm Deputy Commissioner at DSS. So as of March 10th, we had 104 individuals in homeless sheltered in hotels. 86 of those were THA clients, 75 adults and 11 children. And then 18 were Code Blue, were 12 adults and 6 children. And we've been averaging about 25 to 35 people at the Code Blue shelter at Key Bank. So interestingly, even though the temperatures have gotten warmer, the numbers have still averaged around in the mid-30s. What we see is that we have some people some of it's about connection and community. So even though people might have other places to go or might even have other housing, they still choose to come to the Code Blue shelter. Sorry, I just have a tremor, so.
You're fine. You can sit down if you'd like to.
Yeah, feel free.
Can I sit down?
Yeah, absolutely.
So we see that some people are coming consistently, even if they might have housing or other options for connection with people. We've continued to have strong support from our local faith community in terms of providing meals in the evenings. I mean, very consistently they've been providing. So my goal is to maybe work with Monica later this month and get some information out to the community about the good work they've been doing. The average length of stay in the shelter has been 42, so that's down a little bit. So that's our main focus right now. So Code Blue will be ending April 15th. So we have what we call our continuous Code Blue season, where we house anyone, no matter what, because it's supposed to be if it's below 32 degrees, so even if it gets warmer above 32 for a few nights, we'll still shelter them through April 15th. Then we'll close down the key bank, and then if the temperatures drop below 32 after that, we'll work with people to place them in hotels for, it'll probably be a couple nights or something. We're also starting to work with people to get folks who are at Code Blue THA applications so that hopefully they'll continue to receive services and be sheltered after that.
Thank you. Any questions? I do have one, and if you weren't prepared to answer this, that's fine. I'll ask at the next meeting. But the meeting before, most departments shared what their equity indicators were for 2025. So I wanted to know if you all have yours and how you plan to measure and report on them.
Right. So we do have them. I don't have them right in front of me. So I know some of them are focused on, so we've developed what we call a kaleidoscope group. So it's a DEIA group within DSS. We're going to recruit some more folks, and the goal is to identify trainings to come in and continue to have training on that, and then provide support for people to have more discussions about these issues. Not to be clear that it's not going to be HR related, but if there's other things people need support on, that this group would do that. So the goals are to expand that group membership and then focus on bringing in trainings. So we probably have other ones, but I don't have those in my head.
Okay, that's fair. I know that for folks who have come in with concerns about showers for the shelter, for 2 weeks now, almost 3, that showers have been up and running for any folks staying at the Key Bank shelter, or any shelter for that matter, that want to use showers. I think we're averaging maybe 12 people a day, but it's been going now. This is the third week, so we finally have that up and running. So for folks that were concerned and worried, we have something in place now. So I just want to make sure that was shared.
Thank you. Yeah, forgot to mention that.
All right, and Sean?
I think one thing that we forgot to mention on our goals was the advisory board that we were going to do for DSS.
Yes.
So if we could add that, that would be great.
All right, I got it.
Thank you.
Thank you.
Okay.
Thank you.
And now we will turn it over to the county administrator for courses report.
Well, so I don't have any specific report, and we do have some guests here with us that they are coming in from OTDA. I will invite them to introduce themselves. So they are here to engage us, answer our questions, and let us know what they deal with and how their role impacts the community services.
Y'all can come and have a seat.
Oh, come on up.
That'd be great, thanks.
Careful, you might get hired, so.
Yeah, just move it away. If you don't want to talk, if you don't want anybody to hear what you're saying, just move it away.
Well, thank you very much.
It is hot.
Good afternoon. I want to thank the county administrator for inviting members of the New York State Office of Temporary and Disability Assistance here today. I'm a deputy commissioner with the agency, and we've assembled a team of experts that we have dealing with housing. With our shelter staff is on the Zoom to join us to answer questions. But first of all, for me, this is kind of a homecoming. I've been involved in public service for about 33 years, and 18 of those, I was a legislative director for the Association of Counties.
Oh, nice.
And I used to come to work in the county when Martha Robinson was here and Joe Mariani. I was actually involved in his recruitment back in the day. So I'm happy to be here. It's a new chamber since I've been here, but it's wonderful. But again, we know what you're up against. We know the county administrator has spent a lot of time and a lot of effort, and we want to be a resource for you. We have a lot of expertise, And I'll let the members of our team introduce themselves, and then we'll go to the Zoom.
Sure. Good afternoon. I'm Dana Greenberg. I'm the director of the Bureau of Housing and Support Services at OTDA. And specifically with me are two of our assistant directors.
Hi, Linda Camoin. I'm an assistant director in the Bureau of Housing and Support Services, overseeing all of our state and federally funded homeless services programs.
And I'm Sarah Watson, also an assistant director in the Bureau of Housing, and I oversee the Code Blue program, the district's submission of their homeless services plans, and we also manage an 8-county continuum of care.
So not represented, but I can do that representation, is our capital programs unit, which is specifically the homeless housing and assistance program, which is how you can develop emergency, transitional, and permanent supportive housing for homeless individuals.
You have some folks on Zoom that want to
Yes.
introduce themselves?
Hi, this is Cheryl Contento. I am the Deputy Commissioner for Shelter Oversight and Compliance. My office is primarily responsible for inspecting all of the publicly funded homeless shelters across New York State, which includes New York City. And we, I'm just trying to think, I just lost my train of thought for a second. And we work with entities that want to become shelters. So we are also, in addition to doing inspections, we work together on applications and getting, again, various not-for-profits stand up a shelter, and then at the end of the process, we certify the shelter. We try to provide technical assistance and do, respond to questions. Those basically, that's it in a nutshell.
Is that the team?
Yeah, that's our team today, and again, we're here as a resource, and I'll turn it back over to the county administrator, and we're happy to play any role you'd like us to.
All right.
I just wanted to add, I'm Mari Josephson, the county attorney. We also have an executive session planned, so if we get into discussion of a particular contract or, particular providers and such, I'd suggest we do that in the executive session, as that's where it's appropriate, and that we do general inquiries and questions here.
Okay. Corsa?
Yes, so I think I'll just, as I indicated, they're here to listen to us, understand what our concerns are, and then give us any feedback that they have. So I think we'll be open for any question and answer session if anybody has any specific question they would like to ask from our expert guest.
Thank you. Legislators, Randy?
Yeah, just for people watching, what does OTDA stand for?
We're the New York State Office of Temporary and Disability Assistance.
Great, thank you.
Questions, anybody else? Well, I'm Travis Brooks, the chair of HHS. Thank you for taking time out of your schedules to come join us. I was wondering if you could walk us through the process of, and maybe this would be somebody else, but what does it look like when somebody applies for THA? And what role does OTDA play in that?
Well, I think you hit it on the head when you said we're probably not the right folks for that. That kind of falls under our economic security folks. So I really can't answer that question. Okay. I think OTDA's role, without getting too far into not our responsibilities, is to just give guidance to the districts as they do that. So it's done more at the district level.
All right. Okay. Sean?
I think right now, Tompkins County is at a really pivotal point, and we're trying to figure out how to house most people. And we're also trying to figure out, ideally, we would love to have very few people using Code Blue. We would love to have everyone approved for Section 8, more permanent housing so that they can gain some stability in their lives. One thing that I think there are a few things that we're really struggling with. One is mental health. The second is substance abuse. And then I would say the other is trying to get people eligible for benefits. And then, of course, engagement. There's some people that are like, government sucks. I don't want any of it, And so for us as county officials, we're trying to make it where if you walk in our door, we're going to take care of you. And I think that's the first and foremost, thing that we're trying to do as electeds is make sure that the people that want housing can get housing. And I would love to hear what your philosophy is as far as, do we have similar philosophies? What is your vision in a perfect world?
Yeah, first of all, I'll start to let you know that, housing is a crisis in New York State. I mean, every community across the state, both downstate and upstate as well, all of your neighbors. I mean, this is a serious situation. It's a combination of, again, it's mental health, it's resources, it's the inability of people to even afford basic housing. So you shouldn't feel alone. I mean, I'm excited to be here today because
I think you're not quite loud enough, and
how's that?
It might be a little closer, yeah.
All right, thank you. No, again, I think that, just the point I want to make is that you're not alone. It's like, it reminds me of an old HHS secretary had this quote that he used to say. He used to say that there's a time in the life of every problem when it's big enough to see but still small enough to solve. And again, there's a lot of resources. There's a lot of ability for us to help you craft a solution. Again, we can't create the solution for you. It's not the role that we play, but it's to bring expertise to the table and to help you form partnerships that'll help you get some things done. So that's really what we can help achieve. And I think we share a lot of the similar philosophy with what your mission is, what your task is, and what we're trying to accomplish. And I know that people tend to focus on pieces of this puzzle, right? You've got Code Blue, and oh my goodness, we've got to deal with a crisis, and our situation changed overnight, and we had to do something on an emergency basis. You're also looking at, the need for emergency shelter, and that's different for both singles and families. But you got to think longer term too, about affordable housing and supportive housing in particular, where we can lend a lot of assistance to make sure that you have resources to meet that longer term need of the people here in Tompkins County as well too, not just the city of Ithaca, but the Tompkins. This is a county-wide problem. It's just not here in the city of Ithaca. You want to add, Dana?
Yeah, no, I agree with Ken. There was a lot of talk throughout this meeting today about collaboration, and I think bringing together the providers who are doing different types of street outreach. One thing that wasn't mentioned today was through the Office of Mental Health, the SOS CTI teams, which I know is just starting here. We've had previous meetings about shelter. I know there's a plan to apply to our office through the Homeless Housing Assistance Program to develop a shelter for singles. I think that'll go far, but to Ken's point, where do they go next? Section 8 is great, but there are other resources, permanent supportive housing specifically. HHAP, along with Homes and Community Rural, has a project here currently in construction and one that was announced for funding yesterday. So that's a great place to be. We're not talking conceptual, we're talking actual units of housing that will be here in the next year. And it's that building that continuum from street outreach, Code Blue, shelter, all the way into permanent supportive housing for sure. And that's where I think the state has the resources between the Empire State Supportive Housing Initiative, Homeless Housing Assistance Program. And those are all state resources. So
we'll still have them in the future. Is that where you're going?
This executive budget has them. Yes.
I don't know. These are state-funded resources.
Yes.
Amanda?
Yeah, thanks so much for being here. I've been on the legislature for 7 years, but I still don't fully understand what everyone does, and there may be folks listening. Maybe you could just talk a little bit about how the work you do overlaps with what we do, like in practical terms, like maybe kind of what Travis was asking, like on a day-to-day basis, how do you relate to DSS? Like in a practical way, not a conceptual way.
I mean, our agency serves as the state agency responsible for the management of significant federal benefit programs that serve residents all over the state. Again, you mentioned temporary assistance, nutrition assistance through the Supplemental Nutrition Assistance Program. We do considerable housing work. We actually even do Social Security disability determinations on behalf of the federal government. So we're a very large organization. That's where the disability comes from our name. So again, we're large, we're expansive, but we generally, our services are delivered through local social services districts here through the county, and we provide management and oversight of those services flowing through your local Department of Social Services.
So just for clarification, so like our DSS is administering some of these programs, but you're sort of administering the finances and the money through them?
That's correct.
Is that?
And we provide the oversight for the service delivery through the local districts.
So the regulations.
That's a lot of paperwork.
And to just add to that, in our bureau specifically, Linda mentioned being over the programs. Most of the programs that we administer in the Bureau of Housing are grants to nonprofits. Municipalities can apply for some of them, so DSS does have a couple of service contracts with us, but the bulk of our funding goes directly to your nonprofit communities, and they're direct contracts with OTDA, so they don't always have that DSS district level. And then Sarah mentioned the balance of state, which is a continuum of care that we oversee, but we do work closely with your continuum of care and all of the continuum of cares in the state.
Yeah, and again, it's hard to, it's a very large body of work that we do. And quite frankly, with our relationship, with the relationship with your Department of Social Services, if we're not able to directly engage, we can help bring others to the table to help create solutions. Again, we want to be a resource and a partner to Tompkins County as you you're making some big decisions today, right? Over the next several months, and we want to make sure that you have resources so that you all feel really comfortable and well informed as you make those decisions going forward.
Randy?
Yes, thank you for coming. Our DSS department does a lot of good work here, and there's a lot of stresses on them, as it probably all social services departments. And one of the programs that I think might run through you, or you may be aware of, is the Personalized Recovery Oriented Services PROS program. Is that something you're familiar with through the mental health?
OMH.
It's an OMH funded program.
Okay, so it's not under your.
That's right.
Okay. Well, maybe you can answer the question though. So
I don't know about that.
It has related not to that, but where they get a lot of their funding is through Medicaid.
That's right.
So do you see any risk for that?
Well, again, that's well out of our purview, and I've seen the same reports that you've had coming out of Washington. I mean, it's something, we're following every day, looking at, concerns, and certainly Medicaid funds substantial services across our state. It serves, it's just not, people that are low income. I mean, poor people, Medicaid supports so many functions in our state, and especially on the mental health side of the table. So I think we're all concerned about this potential, the numbers that we're hearing, this $880 billion national cut would be extremely detrimental to the residents of our state. And while OTDA not being a direct impact of that, we're concerned about so many other potential federal cuts. In particular, our SNAP program is critical to making sure that people have access to nutrition and resources for nutrition. And again, we're concerned about that. And again, just the whole gamut of our services are at risk. So can't speak to PROS or the Medicaid program in particular, but certainly our agency shares your concerns, and we're monitoring it very closely. And we're hoping to make sure that at least our elected officials in Washington understand the repercussions. I know our agency has gone to great lengths to make sure that we're publishing data about our programs so that we're actually publishing data by congressional district so that members of Congress can understand how many recipients of SNAP are in their district and what the economic impact of those dollars are in their district. And, you know, heat, for another example, it's a critical component for residents of our state to pay the heating bill in the wintertime in particular. And again, those cuts, you know, really hurt people. So we're all working and doing our part, but we all share your concern, but we can't speak to anything that's coming, you know, other than you should know that we're on top of it. Our day is consumed with it a lot of days.
So I know I have some specific questions that'll have to wait to exec session, and maybe after the meeting, you could connect me with folks that I would need to talk to about some other things. But Sarah, right? Sarah, how as legislators can we best support our continuum of care here in Ithaca?
Great question.
That is a good question. Oh, thank you.
I think the best way to support the continuum of care is to listen to what she says the needs are, assist her, and I'm saying her, I mean Liddy, in any data collection that she's trying to do. Maybe it would benefit this group to hear about those numbers. I know Dina shared the numbers in hotels and the warming center that are placed by the Department of Social Services, but there's a whole host of people that are experiencing homelessness that aren't captured by that number, that I think that the continuum of care could help give you the information on, and then to talk about what the needs of those people are, and figure out a way to best respond to those needs. The continuums need the support of their local legislatures to apply for funding, to help plan for things, and I think that having those conversations, encouraging collaboration, which has kind of been the theme today, the more that people know about the work that their partners are doing in the community, the easier it is, I think, it's going to be for people to be able to access those services.
Thank you.
If I could just add to that as well, too. I know that, sorry, we haven't been introduced yet, but you spoke earlier about the need to listen to people with lived experience, right? And I think that's where the continuum of care is a great resource for that as well, too. It's something that we think is very important at our agency, and our commissioner is very focused on gathering input from people that benefit from our services and hearing that direct feedback. And I know that's something that the continuum of care can help bring to that table as well, too, is really understanding how people are perceiving and understanding, and really make sure that you're meeting their needs. And I think that's something that I congratulate you for bringing that up earlier today, and I think that's a great angle as well. So,
So I'm actually on the board of NISAC, and Steve Aquario had come around and asked board members, what do you want to hear about? And I said, can we do a seminar on how to house the hard to house? Yeah. And he was like, excellent idea. And so there was one in the fall conference, and Sullivan County got up, Poughkeepsie got up and talked about all the great things they're doing in housing. And then I raised my hand and I said, so how are you guys housing people that are sanctioned? And they're like, well, we're not. And so I guess my question to you is, how are other counties, are there any tricks or best kept secrets on how to house people that are sanctioned?
Maybe I'll start bigger picture on that.
Okay.
Like I said, first of all, I'll make sure I talk to Steve about that topic as well. I mean, NISAC is all about best practices, right? And I think that's why a lot of people go to the conferences. It's not necessarily for the going to the workshops. It's talking to people offline and understanding that there's a lot of solutions out there that need to rise to the top. The sanctioning is really about compliance, right? And that's the difficult thing. I think that our agency, understands that challenge. We talk to districts about it every day, and we're trying to find our solutions as well too. There's requirements that are in state law that may need to be revisited, but it's something that we should be talking about. Any particular county that you could highlight? Again, it's a tough topic.
It looks like Linda's going to take this one.
Sorry. I mean, so earlier this morning we were at Tompkins Community Actions Project on Green Street. So obviously there's been some issues there lately, but they took people who were living outside. I would assume that most, if not all of them, were sanctioned, and put them in permanent supportive housing. I mean, that ultimately is the goal, is permanent housing. So, you know, you have a project right here that's doing that, and they need some local support. So there's other, you know, examples of that throughout the state. I think Code Blue too is kind of like the interim and seasonal solution to making sure people are safe in the cold weather, and then hopefully that's the opportunity to engage with them so that then they can get to that next goal of permanent housing. That was just the thought that what I wanted to put out there.
I would agree with that. I just want to add to what Linda said, that if you're talking about engaging people who are sanctioned for emergency shelter, it sounds like that's what you're asking about. For us, the goal is always permanent housing. So there is, outside of the Code Blue period, there isn't a way to do that with temporary assistance funding, and that's written into state social services law. And that's why we want to work really closely with the districts and the community during Code Blue, because it is a time-limited period where people who are usually service resistant are trying to access services. And you kind of have a seasonal opportunity to work with people. And so we'd be happy to plan for that next year, is how to best use your Code Blue allocation in a way to permanently end someone's homeless episode, because I think you have an opportunity to do that.
Okay, thank you. I just want to, we're all saying the same thing, but I do want to add, the permanent housing is the end goal, right? So if THA eligibility isn't there and shelter isn't an option, then moving, as Linda talked about, the TCA project that does that. But also, again, I talked, and I know they're not as fully up and running yet, but the SOSCTI team, the whole idea of those teams that the governor introduced really came out of the subway initiative in New York City, and it's the same population. These are folks who, whether it's because they're sanctioned or not, choose not to engage services and choose to kind of live independently, and a lot of it is mental health and substance use, and we know that. And so those teams really bring together the experts who can do that engagement at a very higher level of expertise, and then hopefully they can then partner with existing housing resources. And again, one of the projects that was funded yesterday with we're not going to mention, one of the projects funded yesterday is also the SOSCTI team. So I'm sure once their project is up and running, they would be that filter, because they do plan to do some chronically homeless units.
Randy.
One of the programs that's been successful here, I think, is a program called Second Wind Cottages. I'm not sure if you're familiar with that or not, but it's a couple people, nonprofits, that built these 280 square foot homes. And I think there's 16 of them in this one area. And it's been successful, and I'm not clear on how the funding model for that works. So, I mean, they're 280 square feet, they have heat, they have bathrooms, they have little kitchens, the whole bit. Is that something that is funded as temporary housing by the state?
So I'm not familiar with that program, but yes, the tiny home concept, yeah. Our office through the Homeless Housing Assistance Program just funded in Shenango. They're working in coordination with their local district. So 10 of them will be permanent housing, and 2 of them will be emergency housing, specifically to individuals who have kind of are no longer welcome in the local hotels and motels, and in this same kind of area in which you're talking. So the 2 emergency beds will get certified through Cheryl and the Division of Shelter and Oversight and Compliance, and then the other 10 will be permanent supportive housing. The capital funding is through the Homeless Housing Assistance Program in our office, and the operating funding is coming through the Empire State Supportive Housing Initiative. And I'm not sure if that's going to be one of our contracts or it is one of our contracts as well. So that is right out of our office, that idea. And I would say if you know other nonprofits who are interested in that, we can give you cards today and they can contact us directly.
Okay, great, thank you.
Stu?
Quite a while ago, you were talking, I just want to make sure I understand. You often see that people who are don't want to be housed, you can capture them because they go to a code blue shelter, and then you can work with them. Is that, okay? So I'm remembering, this was ages ago, when I was working at the library, we had a big conference, the Red Cross came, the mayor came. We had it was a whole session on people who needed homes, who were homeless. And we invited members of that community to come and speak at the library. And I've never forgotten this one gentleman who came in and said, I have the money to have an apartment, but I want to live outside. I'm choosing not to do that. And he wanted people to just leave him alone. And yet, you know, when winter came, he was going to have difficulties. So I'm thinking about that population. I've never forgotten how angry he was with everyone in the audience for deciding for him. You know, how do you deal with that?
I mean, obviously, right, people have choice. I think the idea of Code Blue is to give a safe option when the weather is just so cold that your life is in danger. But some, if they need that engagement, and the Code Blue can give that engagement, I think that's probably not always the scenario, but obviously personal choice of where you live and how you live should be respected.
Go ahead. No, I was just going to, I mean, Dana talked about it before, the SOS CTI team, that's exactly what their goal is, to really work one-on-one with people who have been resistant and haven't wanted to engage. And they will also have some permanent units connected to that effort as well. But it can take a while.
I have two quick questions before we go into exec session to ask a few other questions. One, Sarah, this will probably be back to you. Okay. What does a typical relationship look like with DSS and continuum of care? And how can we help COC maintain its autonomy?
That is different in every county. So some of our COCs are co-chaired by a DSS person. On our COC, I can speak for the Balance of State Continuum of Care. We have 8 counties, 3 representatives from each county, one of which must be the DSS commissioner serving on our board. But then we have local meetings in each of those counties where there's DSS presence at every one of those meetings. And in most counties in New York State, the Department of Social Services is the front door for someone who's experiencing homelessness. And so it's important when we're talking about designing a homeless services infrastructure in a community that DSS is at the table explaining to the group what the requirements of their services are, how we can best serve every person who's experiencing homelessness. So I know in our COC, the Department of Social Services is part of the conversation. They're leading the conversation. And they are part of that collaborative process, which for us, again, is we believe in full transparency all the time. And it's helpful in our COC because I can always get other state representatives to come and to talk about the requirements of their individual programs. But in others, in other counties, it might not work like that. So it really is different across the state. But what we found in our COC that the best practice is having the social services there in a leadership role.
Thank you. The last question I have is there's so many different regulations with so many different programs. And I'm not an expert in any of them, nor do I want to be. But we get a lot of constituents who contact us with concerns, issues, whether it's folks that are trying to utilize services, providers that are trying to help people get services. If I had a question, if any of my colleagues had a question, and we needed to contact OTDA to get some answers for ourselves, who do we contact? I reached out once, and I was told that the person I reached out to said they had to talk to a supervisor and get back in touch with me. And I didn't hear anything back. I didn't want to press the issue. But Well, who can we call?
I'm going to offer myself. So
All right,
please
cool.
call me directly. I will work with any legislator as part of this body. And again, I work directly for our commissioner. I have access to the resources of the agency, and I'd be happy to work with you to get answers that you need.
Awesome, thank you. Is there any other questions? Dan?
Travis, may I?
Yes.
Thank you. I wanted to ask a little bit about the HHAP program, Homeless Housing and Assistance Program. We are moving closer every week towards making the decisions necessary to start on building a shelter. We've hired a consultant. Our consultant tells us that they think we're right in line with what HHAP funding would provide. Now, so I just wanted to ask you a little bit about that. Are we hearing, I want to hear directly, is that what the money is for? Are there more requests than you have funding for? And I have a few more questions. I'll stop there.
Sure. So the Homeless Housing and Assistance Program is a capital program specifically to build housing for homeless individuals. So emergency shelter, transitional, or permanent supportive housing. The main requirements of the program is that the individuals to be housed are homeless. There will be support services on site, and that the one thing that HHAP can't fund is the ongoing operation. So you have to have an operational funding plan. Obviously, the application is much more cumbersome than I just made it sound, but those are the bare requirements. So obviously, emergency shelter falls into that. You are required to get certified with our office. Again, that's Cheryl who's here as well. And then if the person is not sanctioned, then obviously the THA becomes how you're funding the shelter. We did come out, we did tour the Cherry Street site with DSS and the county administrator, and the consultant that was hired does a lot of work in our office. So she is very familiar. To your other questions, we're currently not accepting applications. We were oversubscribed for this current state fiscal year, and we closed in August. Our intention is to open as soon as the new state budget passes. The Homeless Housing Assistance Program last year and the last couple of years was funded at $128 million. It's in the executive budget with a little bit of an increase. So to be determined, and municipalities can apply, or non-for-profits or faith-based organizations. I think the largest hurdle that your application is who's going to be the applicant. And there is a little bit of a difference if the municipality is the applicant. We have had other counties who have done that for shelter. So we've shared those with DSS and the consultant so that those items are taken into consideration so that the application can be successful.
Thank you. And we were told it was a $15 million limit last funding cycle?
Correct.
Are you able to anticipate what the funding limit might be on the next cycle?
I don't believe that we will be changing that.
Okay. And that is not matching money at all, is that correct?
Correct.
Well, great, thank you very much.
It's an amazing program that really is something that you should tap into. And again, as Dana mentioned, we were oversubscribed last year. It's not an unlimited pot of money, so we would encourage you to look for when we release the funding application and to act quickly if you'd like to access it this fiscal year.
And to your point about match, I just want, the match is the services that will be provided and how you operate it. Because it's a 25-year contract technically the contract's with the Homeless Housing and Assistance Corporation. It's just the way the money flows, so it's not an OTDA contract. But it's a large commitment, so that's the match. The idea is that a nonprofit or a municipality can open the housing debt-free for someone to move in. And if the money goes, if the carrot is given early, the stick is the next longevity relationship.
Great, thank you very much.
Any other questions? All right. In accord with Article 7, Section 105 of Public Officers Law, executive session is only appropriate for the discussion of, in this case, the medical, financial, credit, or employment history of a particular person or corporation, or matters leading to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person or corporation. Do I have a mover? Do I have a second? All right. All those in favor? We're moving into executive session.
Is there anybody else online that